Information or evidence is what really guides our practice, both as medical practitioners and as nurses. So having access to that evidence where we are as a learner or as a practitioner is really important. The Minnesota Alliance for Nursing Education is an alliance of 7 community colleges and a university who have come together to offer a dual admission program, baccalaureate program, to students across the state. We have students in both rural and in our urban settings. Even though we are an alliance, there is not equal access to resources within the library for all of those students. Having the Minnesota Electronic Health Library available to those students would give them the same ability to access information, to guide their learning, and to guide their eventual practice as well. Rural practitioners will receive a benefit from the Minnesota Electronic Health Library. Many of the institutions or organizations in which they work will not have the financial support available to have an electronic health library. Being able to offer this support and service to the rural areas will give those practitioners, both medical and nurses and other healthcare providers, immediate access to up-to-date information that was not accessible to them before. It will provide an incentive to remain in those healthcare areas as well and promote a good practice. For example, a niece of mine who lives in upper outstate or northern Minnesota, and her mother-in-law lived with her for 2 years. She had ALS, or Lou Gehrig's disease. She was on a ventilator and required multiple aspects of pretty in-depth care in the home. It would have been extremely beneficial to have the Minnesota Electronic Health Library at that time. There were often questions that arose that the nurses or the healthcare providers had difficulty in answering from far away. And so my niece would pack her mother-in-law up on a vent and go a 2-hour drive away to the nearest medical facility that could help them. Having that electronic health library access in their own community would have probably alleviated some of those visits and saved healthcare cost and saved frustration and anxiety and concern for both the family and the patient in that instance, let alone the healthcare providers.